So, as I said earlier, my name is Maria Hudspeth. I'm the executive director of a charitable organization called Pain BC, based here in British Columbia, but also Pain Canada, which is our national action network. I am coming to you from the unceded ancestral territories of the Musqueam, Squamish, and Tsleil-Waututh peoples, and I encourage you to reflect on the land upon which you are coming from this morning and express gratitude to Indigenous peoples who have stewarded these lands since time immemorial. Just a little bit of housekeeping. So, we wanted to do this webinar because, believe it or not, we're coming up to the 5-year anniversary of the launch of the Action Plan for Pain in Canada. That will happen in spring of 2026. So, we wanted to reflect on, where have we gotten to, where else do we need to go, and what are emerging kinds of issues and priorities that we need to pay attention to. So I'm going to do a run through of a bit of the history, talk about each of the 6 goals, and highlight some of the progress towards them. There will be time for question and answers at the end. The webinar is being recorded, so if you miss some of it or want to come back and watch it later, we will be distributing the link. We are going to have a few things happening during the webinar. So there is a Q&A function, question and answer function at the bottom of your screen, as well as the chat function. We're going to be taking questions at the end, but feel free to post them as you think of them, and then we'll be answering them. I'll be answering them live as we go. If there are questions that are posted that we don't get to, we will certainly send out a written answer to people who participated in the webinar. There's also a chat function. We'll ask that people limit their use of the chat function unless it's something very critical, just because many webinar attendees find it quite distracting. But if you have things that you want to say in the chat and they're critical, of course, please do that. I'm going to ask Muskan to launch a poll just to help us understand who is in the room. So a poll should come up on your screen, and then we're just asking who is in the room and what's your connection to the issue of chronic pain. So you can choose multiple things if you're a person with lived experience, as well as a policymaker or researcher, etc. So I can see folks are completing that poll now. Great. So we have about 30 people in the room, and about 63% are identifying as people living with pain, about 40% people who are representing a pain organization, some researchers, policymakers, health professionals, all in smaller numbers. And of course, the poll doesn't add up to 100 because many people are have multiple identities. So we're going to end the poll. And here I will share the results so folks can see who is in the room. Great. So I'll stop sharing and we'll get into the meat of the presentation. Just so folks are aware, while I am sharing my slides, it's very difficult for me to see the chat or question and answer. So if you are posting things there, I'll ask Muskan to just unmute and interrupt me if it's something critical. And if it's questions, we'll keep them for the end. Okay, so just a little bit about Pain Canada. So, Pain Canada is a national action network. It is really a coalition of many different pain organizations, advocates, people with lived experience, researchers, as well as several provinces and territories who are part of the Pain Canada network. Our The model of Pain Canada is that it isn't its own independent organization. It's an initiative of Pain BC. And there are many reasons why. I won't go into all of them, but Pain BC over the last 15 years has developed quite significant infrastructure. And we wanted to be able to support the launch of a national initiative without spending 5 years building it, just being able to essentially turn on a lot of our infrastructure in service of this national goal. So that's why it really is under the Pain BC umbrella. Pain Canada is funded in large part by Health Canada. And of course, the things that we're saying, our views and opinions, are not necessarily the views of Health Canada, but we certainly acknowledge them as well as a number of other philanthropic supporters. So just going back about 20 years and even before that, we could see the roots of a movement around recognition of chronic pain taking hold in Canada. Canada has always hit above its weight in pain research. So we have incredible leaders in pediatric pain, in sex and gender differences in pain, a number of different areas. And that leadership role in the global research space actually brought an international scientific meeting. This was a scientific conference held by the International Association for the Study of Pain. That meeting was in Montreal, and there was a recognition of treatment of pain as a human right. So from there, we started to see this growing movement. So, the start of grassroots organizations, more and more people with lived experience as advocates, health professionals, and researchers using their voices to kind of amplify the issue of pain. We started to see in about 2016 the creation of research networks that had a focus not just on research, but also on the engagement of people with lived experience. And over time, we started to see increasing strategic policy and movement building approaches. So these are approaches that, for folks working in harm reduction, HIV, mental health, um, gender-based violence, like all of these difficult social and health equity issues, people have over time built movements. They've made the case to government. They've brought even corporations in as allies and supporters. And we've really started to see over the last 20 years the growth of these kinds of organizations and initiatives, and really a movement around pain in Canada. Some of the backbone of this movement, like the Canadian Pain Society, I mean, that of course goes back much further than 20 years, but really we see incredible traction over the last couple of decades. Many of us had been trying to bring the federal government to the table, wanting the feds to play a bigger role in the recognizing of pain and to really use the levers available to them to drive change on this issue. We were successful in 2019, and when I say we, I'm really talking about a movement of advocates here. In 2019, the federal health minister created the Canadian Pain Task Force. This was a small group of 8 people, including people with lived experience, with a broader expert advisory panel. And we were asked to do 3 things. So really assess the state of pain in Canada. That was our first report, doing a broad consultation and mapping out best practices and sort of possibilities for improving the situation. And lastly, the action plan for pain in Canada, which was a change to our original mandate. The minister recognized that we needed to be making concrete, actionable policy recommendations to government and many, many other organizations and institutes to really make this change. So that action plan was launched in 2021. The action plan includes 6 overarching goals, and these won't be a surprise to anyone living with pain or working in the pain space. They really reflect a global consensus about what we need to do to drive the recognition of pain and to transform how pain is understood and treated, and ensure that people living with pain are recognized, supported, and can get effective care. So these 6 are overarching goals. I'm going to walk through them today and provide a bit of a snapshot of some of the progress that's been made as well as gaps. Before we go into the 6 goals, just to talk a little bit about the approach. So, in the action plan, we did not just point at the federal government and say, here are things that you need to do, because we know that the role of the federal government, especially in health, is very specific. They're a funder, they provide guidance. The federal government, of course, has a role to play in approving drugs, in legislation, in regulations. Many of these things are top-down types of roles. They certainly have a key role in bringing together the provinces and territories, obviously transferring funding to the provinces and territories who are responsible for delivering care. But there are so many bottom-up things that need to be done, things that need to be done by everyday people living with pain, whether that's peer support, whether that's local organizing to improve things in their local community. We know that not-for-profit and charitable organizations have a big role to play, professional organizations, research organizations. So this is just a very small proportion of the number of partners within Pain Canada, but it gives you a sense of, it's not just looking to government, it's really saying what can each of us do to improve the situation for the 1 in 5 people living with pain in Canada. Shortly after the action plan was created, so that was 2021, Pain Canada was launched in 2022, and then we created this action tracker. So this is an online website. It's interactive, so anyone can go onto this site and look at the progress being made by goal or by individual recommendation. So when people go to this website, each of these little dots represents a specific recommendation under a goal, and you can hover over these dots and see the progress that's been made, and you can use these toggles up top to say, I only want to see things that have been completed, I only want to see things in progress, things that are not started, or things that are ongoing. So I encourage folks to see this. We update it once a year in time for National Pain Awareness Week in November. So let's go into the goals, and I apologize to all of you in advance for these very dense slides. I don't usually create slides with so much written text, but for this webinar, it was necessary. So I'm not going to read what's on the slides. I'm just going to give you a little bit of commentary on the kinds of things that have happened and a bit of context around them. So the first goal was really about recognizing pain and addressing it as a public health priority, and ensuring that as more and more was happening, that there was coordination. We know that when there isn't coordination, you can get fragmentation, you can get duplication, there's a lot of wasted effort. So we really wanted to see a coordinated effort. One of the major things that happened after the creation of the action plan was the dedication of a policy team within Health Canada. So we have incredible partners within the federal government that are responsible for being that internal champion, not just within Health Canada, but across federal agencies. So whether this is Employment and Social Development Canada, Indigenous Services Canada, Veterans Affairs, we know that many different federal departments have a role to play in the lives of people living with pain, and that chronic pain policy team is there to shepherd this issue through that very complex set of systems. Of course, we launched Pain Canada in 2022. Pain Canada has a national advisory committee that informs its work, and it has several subcommittees that are working on standardizing communications campaigns, standardizing role descriptions for pain clinics across the country, looking at supported self-management and what can be done there. So lots of efforts to bring people together, but not just sit around and talk, really get into the doing of improving pain services across the country. There was a National Congress on Pain, co-hosted by the Canadian Pain Society, Pain Canada, and Health Canada in 2024. And that was really the first time we saw such a huge number of provincial, territorial, and federal policymakers engaging in the pain space. So lots of this coming together, but also some significant federal investments. So the federal government runs a number of granting, they're called grants and contributions, but there's streams where the federal government funds community organizations, universities, or others to do specific work. And we've seen unprecedented investment from the federal government on pain-related initiatives over the last 5 to 6 years. So a little bit about the gaps. Even though we've built Pain Canada and we've had a very generous 5 years worth of funding, that's a time limited thing. We're hoping to sustain Pain Canada, of course. We know that there are many, many organizations and groups that have a role to play in implementation. And we're a small but mighty team, but we just have not been able to bring everyone to the table. So, for example, we know that many, many people who live with mental health and substance use challenges also live with chronic pain. We know that pain is a huge issue among Indigenous people in this country. So there's so many other groups and networks and organizations that we want to connect with, and we're hoping that that will be part of our next chapter. We also know that many of those groups are dealing with their own challenges. So pain might be a critical issue for their constituency, but they've also got their own priorities. So we're increasingly trying to get pain on the agenda, not just in the pain space, but in the mental health space, in the substance use space, et cetera, et cetera. We're seeing now 9 provinces and territories that have provincial strategies, and that's an incredible win. I mean, that's just light years ahead of where we were when the action plan was created. That said, those provincial pain strategies are still in their infancy. They're just getting going. They're a few years in, and in some cases, they haven't been sufficiently funded or empowered to really drive change in their jurisdictions. A lot of progress here, but still a ways to go. So on goal 2, this was really about improving access to care. And we know that this is so critical for people who live with pain across Canada. Often, as advocates working in this space, we see a lot of momentum, we see a lot of progress. But for people on the ground trying to get care, trying to get into a clinic, people that are being maybe weaned or cut off of medication, people that can't afford the treatments they need. we know that there's still so much more to be done. So, as I said, 9 provinces, and we've listed them here, are developing or revising pain strategies, and there's very significant progress. So, a few years ago, Manitoba, as one example, launched a $40 million investment in expanding pain services over 10 years. So, they've made big headway on reducing their wait list, lots of progress in Newfoundland and Labrador, big investment in Ontario and Quebec, et cetera. So lots of work here. We see progress on improving wait lists. We see new models of care, so integrating some pain specific services into primary care, virtual pain programs, a lot of really exciting things happening on the ground in communities. The Our partners at Solutions for Kids in Pain Network, they worked with the Health Standards Organization to create the first in the world pediatric pain management accreditation standard. So that was just a game changer. And again, Canada leading the pack. And now we see that a similar accreditation standard is being developed for adults. And for folks who aren't familiar with accreditation standards, these are the standards that hospitals and clinics need to meet. There are independent accreditors that come into every um, major health organization in our country, and they come in and they assess how that institution is meeting these standards. So to have pain standards coming is really going to go a long way to driving the recognition of pain and the appropriate treatment of pain. We know that there have been a lot of issues with the care of people who live with pain and who use opioids for pain management. We saw a massive pendulum swing away from opioid prescribing starting in about 2015, 2016, and people being weaned aggressively or even cut right off of medication, which is incredibly dangerous. There are new guidelines on opioid prescribing that provide greater clarity, especially on issues of tapering and discontinuation. And we're hoping that that tries to bring that pendulum swing more back to a balanced place where people who need opioids for pain management can get them. There have been some interesting roundtables convened by Health Canada, CIHR, and others. One of them has kind of a hilarious name called the Best Brains Exchange, but this is a way to bring people together who are leading research or innovations on this issue. So, again, more discussion, but actually seeing that it's leading to change. So, on the gaps here, we know that community-based organizations and the kind of work that they provide, peer support, groups, things that can really go a long way to ending social isolation for people who live with pain. The funding for those groups is so limited. Pain BC is one of the only funded community-based organizations in Canada, and we are advocating strongly for other provinces and territories to step up and fund these kinds of community-based supports. We know that people have powerful interactions with health professionals, but often it's very time limited, and the thing that they can access over and over again, and that's very powerful, is peer support and these kind of connections with other people who have had a similar lived experience. So that is something that we're really hoping to see change going forward. We know that there are incredible issues, not just in the pain space, but across the board around the health workforce. People can't get a family doctor. People are waiting, even in many communities, to get access to physio, to get access to occupational therapy, massage, psychology, social work. So we really need a national health workforce strategy that has some focus on pain. Many parts of our country, we still have doctors working predominantly in a fee-for-service model where people can get a 7-minute appointment. But physicians are not incentivized to provide care to people who live with pain in that model. There are no fee codes for treating chronic pain. So there are just significant challenges with the way the system reimburses people and how that then has a knock-on effect on care. And of course, we know that inequities persist across Canada in remote, rural, Indigenous, and other marginalized communities. So lots of work has been done to increase awareness, education, and training for pain. So since 2021, the small communications team at Pain BC, Pain Canada has been coordinating National Pain Awareness Week, and we now have hundreds of organizations, very, very diverse organizations, participating in that campaign. We're seeing more and more courses and trainings for health professionals, whether these are in medical schools or other university programs, or whether they're what we call continuing professional development courses that are available for health professionals after they graduate and they're out in the workforce. So lots of different programs like that, whether they're these programs that are called ECHO. This is where a team of pain experts provides a case-based conferencing to a group of learners in the community, or the adaptive mentorship networks, again, an interdisciplinary group of paid experts that mentor other health professionals, but they do it in all kinds of ways, small groups, by text. They hold a journal club. They hold Zoom meetings. So it's a very flexible kind of mentorship model. And we're seeing those spreading across the country. There's some great work being done with a focus on equity seeking communities, including some Indigenous specific education models that have been created. So more to come on this. There, of course, remained a tremendous stigma for people who live with pain, in particular for folks from equity-seeking communities, for men working in the trades or natural resource industries, and for people who require opioids to manage their pain. We see that there's still a lack of standardization and consistency where competencies for pain, again, the thing that is used to measure, are you ready to go out there and be a doctor? Are you ready to go out there into the world of nursing or any other profession? Those competencies are not consistently embedded, and we still need to see that happening. And we still have gaps around training specific to sex and gender, people with disabilities, a number of other diversity considerations, although we are going to be launching some courses on that through Pain Canada in 2026. So jumping over to research, I'll move a little bit more quickly. So of course, Canada continues to be recognized as a global leader. There have been two significant international scientific conferences here in the last few years. We see what's called the Tri-Council. So these are the big research funding agencies in Canada. They have advanced the engagement of people with lived experience. They've launched policies. They expect researchers to compensate people with lived experience. So that's really been taken up in the pain space. So all of the research networks working in pain are engaging people with lived experience. People are recognized for their expertise. So I think that's an incredible strength. The Chronic Pain Network, this is a national research and knowledge mobilization network funded by the Canadian Institutes of Health Research. It launched an online portal called Pain Connect. And through that, if you're a person with lived experience or you're a researcher and you want to meet each other, you want to say, hey, um, I'm living with endometriosis or chronic migraines or whatever the issue is, or I'm a researcher working on those topics. This is a platform that can connect you and get, if you're a researcher, get you connected to a patient partner. If you're a person with lived experience, get you involved in research. So incredible resource. And you can just Google Pain Connect and you'll find it. We've seen an expansion of social science research. So for a long time in Canada, we excelled at research in the lab. So this kind of basic science research that we had leading innovators in that space, but increasingly we're also leading in social science research. So looking at issues like social determinants and critical approaches to thinking about pain. So the Pepper Initiative and others are leading in that space. We have multiple research networks that have received multi-year funding, or even if they've gotten a short extension, this continued investment to try and ensure that the investments in pain research bear fruit and really have impact. So we're seeing things like the Canadian Pain Society partnering with Pain Canada to launch national pain rounds. So again, just an ever-growing number of initiatives for folks to connect to, where we're bringing researchers not just together on their own, but together with health professionals and people with lived experience. So, what are the gaps here? Well, there's a significant gap in sustaining research infrastructure. So, we had some great starts with things like data registries. So, these are things like where clinics would gather the names and the information on patients, and then they can be pulled on for other research. Because one of the big problems in the research space is that we just don't have enough subjects or people who can be studied to get breakthrough kinds of new knowledge. So, not having those data registries, not having support for clinical trials, these are significant limitations that we're dealing with. One of the biggest problems is that pain continues to be an orphan. So, in the Canadian Institutes for Health Research, as an example, there are institutes for all kinds of conditions. So, musculoskeletal health and arthritis, mental health and substance use, a sex and gender focused institute, an Indigenous focused institute. There is not a pain specific institute, and some would argue that we need that. Others would argue that we just need a mandate to say, all of those institutes, you have to study pain in some way and you have to invest in pain research. So that sort of, it's everywhere, but it's nowhere, is still a very significant problem. So we know that there are areas like complementary and integrative healthcare that are still very underdeveloped. We also see that there are federal funding cuts coming. Some federal funding areas are being cut quite significantly, but research is actually having a much smaller cut. So we're hoping to see a continued investment in the pain research space. So, having been involved in the writing of the action plan, this is the goal where I say, with all respect, this is the geek goal. So, this is about what we call pain surveillance. So, this is data and the census and trying to look at the prevalence of pain in the population and how our investments are changing those outcomes or not, and really monitoring that and improving health system quality. So we know that what we measure, we improve. If we're not measuring something, we really don't know how bad it is. And we also don't know when things start to change. So there's been work behind the scenes, and in large part led by leaders in the research space and by the chronic policy, pain policy team within Health Canada, to embed chronic pain questions into really foundational surveys that are used by governments, not just the federal government, but provinces, territories, municipalities. They all look to these things like the Canadian Community Health Survey and the Canadian Health Survey on Children and Youth, and they use that data to invest in programs in their local context. So that is hugely significant to have pain questions and data coming out of those surveys. We're embedding through the federal government pain-related disability prevalence being tracked through the National Survey on Disability and a number of other areas where we're integrating not just pain, but sometimes other questions like not just are you living with pain, but are you a veteran living with pain? Are you a woman living with pain? Are you an Indigenous person living with pain? And integrating those into data sources. So we know that a few years ago, the World Health Organization, they are the body that say, what are the international classification of diseases? What's the standard definitions of diseases that we're all going to agree to? And that's called ICD. The latest version is ICD 11, so this International Classification of Diseases. And in the most recent version, ICD 11, chronic pain for the first time is recognized as a chronic condition in its own right. So there's primary chronic pain and secondary chronic pain. The adoption of those classifications can take a very long time before that filters down into the way that your local hospital or your local clinic is coding things. But we are seeing progress in other countries and we want to learn from them. Finland has adopted ICD 11 recognition of chronic pain across their health system. Thailand is moving in that direction. So that's something we really want to see in Canada, not in 10 years, not in 5 years, but hopefully sooner than that. Um, Lastly, around goal 6, this was really recognizing that pain impacts people across the lifespan, but it disproportionately impacts certain populations. So we know that many populations that also face barriers to care have disproportionate rates of pain, whether that's racialized folks, indigenous populations, LGBTQ2S populations, women, seniors, men in the trades, the list goes on. So there are a number of different initiatives underway to try to improve this, including some work led by Indigenous Services Canada, Thunderbird Partnership Foundation, and the First Peoples Wellness Circle. So this was really to tailor approaches so that both assessment and treatment are more appropriate, culturally safe, and community based. There's some incredible work being done through the Chronic Pain Center of Excellence for Canadian Veterans, a number of different women's health initiatives, including work done by the Center of Excellence for Women's Health based here in British Columbia, where they applied a gender lens to the action plan and they really looked at all of those recommendations through that perspective. So, an incredible report if people are interested in that specific area. We're seeing some great work happening in the pediatric pain world through Pain Canada. We've launched programs that are culturally tailored in 7 languages. We've partnered with Corrections Canada to spread some of those programs for people who live with pain in prison, and more work happening in the substance use space, where again, we know that many people are also living with pain. So, what are the gaps? Well, we know that non-insured health benefits for Indigenous peoples remain very complex, limited supports to access those, and that creates an additional barrier for Indigenous people who are living with pain. While there's been some work on anti-racism and cultural safety training, I think we're seeing a bit of a pullback on that, certainly after the election in the US and a broad assault on EDI overall. We're not seeing that to that degree in Canada, but still much more work to do here. In the employment space, again, we know that the healthcare system is not the only system that impacts people living with pain. People living with pain have incredible challenges in the workplace. So we need to be advancing pain inclusive employment standards, benefits, return to work policies, and just greater compassion and skill in supporting people who live with pain to have meaningful employment. There are relatively new long-term care standards that came into effect a few years ago, and those have more of a focus on pain than they have historically. But we know that people who live with disabilities and people in long-term care continue to face barriers with appropriate pain assessment and management. So again, more work to be done. Okay, I'm gonna wrap up and have some time for questions. I know that uh, probably felt like a lot of talking, covering a lot of ground, but I did just want to give folks who were interested a bit of a sense of where we are at in Canada, where we're going. We are going to be conducting, or we're in the middle of conducting an engagement process. So we have a survey where people can comment on their views of the action plan and the progress that we've made and identify other opportunities that we have to improve things in Canada. I'll share the link to that survey, which is open for about another 10 days, so till November 23rd. We're then going to be bringing all that feedback together and working with Pain Canada's National Advisory Committee and others to map out the next chapter. 5 years later, where do we need to go? So if you're interested in all of this work, I encourage you to sign up for Pain BC's newsletters and Pain Canada's, where the Pain Canada newsletter is in both French and English. We're also active on a number of different social media platforms. I encourage you to follow us there. We'll send out the link for the survey. And then if you're particularly interested in pain research and advocacy, I encourage you to get involved through things like the Pain Connect Hub, where you can really have that face-to-face connection with researchers that are trying to improve things for folks living with pain. And then if you have a local pain organization, we encourage you to connect with them or connect with us, and we'll try and make those connections for you. So I'm going to stop sharing now so I can see the chat and questions. But please, if you have them, post them using the Q&A or chat. And I look forward to your reflections. Okay. Do we have letter templates for advocacy purposes? I see in the chat. Yes, we absolutely do. We have a number of templates that we make available through our website during provincial and national or federal elections. So we have those available at those peak times when people are out there, but we also can produce letters that are more general that could be used outside of an election cycle. So that's a takeaway for us to take back to our communications team. And if you're specifically wanting something like that, just reach out to us. You can email info@paincanada.ca and we will follow up with you. Okay, I thought I had seen another question about whether there was an organization like Pain BC or Pain Canada in Manitoba, and I don't see that question anymore. But for folks in Manitoba, to our knowledge, there is not an organization of our type in Manitoba. There is an incredible group of people working to expand access to pain services in your province, and we're certainly encouraging them to support the growth of this type of uh, question. Okay, Sorry, Paul, I'm answering. I see your note in the chat there, answering the question anyway. So yes, we, I think the pain landscape and how it's evolved has been sort of atypical. Some big health charities, they start, they have a federated model, they have a national organization, and then they have provincial and territorial chapters. Some of them just have a national organization and they do some service delivery in each of the provinces and territories. In this instance, there are a smattering of not-for-profit organizations that exist for pain across the country. Some of them are grassroots, peer support type organizations. Some of them are professional organizations like the Pain Society of Alberta, where the focus is primarily on clinical training and holding an annual conference. So, our hope is to really grow these types of organizations. So, the kinds of services that we have available here in British Columbia can be available across the country. So more peer support, more community-based pain self-management programs, and more opportunity for connection and movement building. No, it was not built on, it wasn't a federated model, Paula, to your question in the chat. It really was a group of people coming together saying, now we have this action plan in Canada. We need a national initiative that's a or national organization or network that's a big tent. It's people with lived experience, it's government and policymakers, it's health professionals. And we needed it to be an entity that had existing infrastructure, had existing staff, had charitable status, had communications resources, because otherwise we knew it would take 5 years or maybe longer to build something like that. So that's why we went with this model of having Pain Canada as really an extension of Pain BC. I hope I've answered your question there. Okay, I do not see, other questions. Okay, I see that one. Are doctors and nurses getting more training while taking their training? Yes. So, Shelley, to your question, so the Association of Faculties of Medicine of Canada, so that's the umbrella group that brings together all 17 medical schools in Canada. They actually created specific curriculum on pain and opioids. From my point of view, I think that it was sort of more opioid focused and not so much pain focused. But it still definitely has some helpful content. I think the challenge has been, even though we are training people and we're trying to help them understand that opioids have a role in pain management. People cannot be cut off opioids. When tapering happens, it needs to happen with consent. We still are struggling to get this pendulum swing from, where it went all the way over here to like, where people were getting cut off. People can get access to medication even after surgery if it was necessary. So this has just been incredibly sticky. And I don't think we're going to be able to train our way out of it. Training is going to be part of it. But I think there's a bigger attitudinal shift here. I think there's things that can be done with regulations, because for some people, they're really being denied care. And denial of care should be something that the medical regulars care about as much as they care about managing opioid prescribing. So, yes, they're getting more training, but absolutely, there's many are still reluctant to prescribe, and those stigmatizing attitudes are still very prevalent. Heather, to your question, any suggestions on how to develop in a head assistant developing a pain society. So there's actually some folks in Nova Scotia who are keen on this, and actually across the Atlantic provinces in Newfoundland and Labrador. So there's some sort of bubbling up of these conversations. I would love to have that conversation if there are a group of people in Nova Scotia or other provinces where they'd like to create this type of organization. Through Pain Canada, we supported the growth and development of Pain Ontario to help their founding board get established, to help them get incorporated and get their initial branding. And now they're out there trying to raise money and expand what they're doing. So Pain Canada is absolutely an engine and vehicle to help you. And please reach out to us after the webinar, and we'll see what we can do to bring folks together. Therese, I see your question. I'm wondering if training in peer support is available. Um, so yeah, so through our peer support program, that so we have a peer support program that we run under Pain BC in British Columbia, and then under Pain Canada, we run training for pain focused peer support organizations across the country. And that training is actually provided in collaboration with the Canadian Mental Health Association. So there is absolutely a focus on mental health. I don't know the depth of the focus on substance use in the curriculum, but I'm happy to follow up with you afterward, because absolutely we know that so many folks are living with, whether it's depression and anxiety or very significant mental health issues. Not that depression and anxiety aren't significant, but sometimes people are experiencing those and they're very significant. Other times they're more mild, but people can also be living with, very significant addiction or other kinds of challenges. And we need to be able to reach everyone and have tailored and appropriate resources for them. So I'm going to follow up with you and connect you with Melanie, and she'll be able to answer the specific question about how much of a focus on substance use is in our peer support training. Back to your question, Paula, about curriculum in nursing school, psychology, and pharmacy. So it was a big win for the medical schools when the Association of Faculties of Medicine brought them all together. I think having that sort of umbrella, standardized kind of approach was very useful. We have not seen the same sort of standardization. We see pockets across the country in physio, in nursing, in pharmacy, but not that consistent. We're going to bring all the schools together and everyone's going to sign on to a specific pain curriculum. So again, I think that's the kind of thing that we would hope to see in a next chapter. Is there any push for these? So yes, there is, but I would say um, anything that is health workforce related, the challenges with just the shortages of health professionals, the kind of burnout that we've seen after COVID, we've just found that working in that kind of health human resource space, whether it's training, curriculum, other kinds of workforce issues, it's been very, very challenging because people are sort of like just keeping their heads above water. So I think this is, again, the kind of thing where we would want to engage our government partners to try to have a more concerted, not just bottom up local champions kind of moving this forward, but a more kind of top down standardized approach. Okay, I am not seeing any more questions. Um, yes, Paula, to your point. Yeah, of course. Yes, those are all arguments that we would be making. Um, and I think we are making those arguments. We just want to see more progress in that area. We just are finding that there's spaces in healthcare in particular where people just getting the attention when everyone is always feeling crisis, it's very challenging. So definitely, absolutely a valid argument. Um, okay, I think that is all the questions. Thank you so much for your attention and for being interested. Um, when the task force was still going, we were seeing such incredible momentum, and we were so worried that when the task force mandate concluded, what's going to happen? How do we keep this going, and how do we really drive this change, not have this be a report that sits on a shelf? And I think we can say, coming up to the 5-year anniversary, that that has happened in no small part due to the incredible dedication of people with lived experience, using their voices, advocating, researchers, health professionals, really an incredible array of people working together to drive this change. So I'm delighted to give you a bit of an update, and please stay connected with us in this larger movement. Thanks so much for all the feedback in the chat. Um, Happy to be with you all and grateful for the opportunity. So I think we'll call it the end of the webinar. Thanks for coming, and we'll wrap up. Take care and thank you again.